We are now going to discuss about diabetes insipidus. This topic is not very important for NAVLE, but you just need to know a few lines about this whole topic, but I will explain it to you fully. So diabetes insipidus is the metabolic disease in which there's a deficiency of ADH hormone, which is antidiuretic hormone, also known as vasopressin. So ADH or vasopressin is released by pituitary gland, and its release is triggered by decreased BP, decreased blood volume, dehydration, stress, etc. And certain drugs also trigger the release of ADH by pituitary gland. Now this ADH, it acts on kidneys as well as blood vessels. What does it do? When it acts on kidneys, it increases water resorption. That means water will tend to remain in the body, and this hormone is responsible for concentrating the urine. On the other hand, it causes vasoconstriction in the blood vessels. So overall, it will increase the BP, it will increase the blood volume, and it will concentrate the urine, which means that urine will not be dilute. Diabetes insipidus classification consists of two types: central diabetes insipidus CDI or nephrogenic diabetes insipidus or NDI. So first of all, the CDI, the central one. Pituitary gland does not release ADH, or there is inadequate production of ADH. So basically, the ADH is messed up here. So there is no ADH available. The causes are pituitary tumors, injury, etc. So anything that affects the pituitary gland. Now the nephrogenic diabetes insipidus, in this case, pituitary releases ADH. That means ADH is normal, but kidney does not respond to ADH. So here the kidneys are messed up. So there are two types of nephrogenic diabetes insipidus. First is primary, which is due to congenital lack of ADH receptors. The secondary one is due to drugs, diseases like Cushing's, leptospirosis in dogs, pyelonephritis, liver disease, hyperthyroidism, diabetes mellitus. These diseases will interfere with the receptors of ADH on kidney. So basically, kidney will not be able to respond to ADH hormone at all. So if there's a deficiency of ADH, what will be the clinical signs observed? Now, deficiency of ADH will lead to increased urination. That means polyuria. If there's no ADH, that means large amount of dilute urine is produced. There is massive water loss. So this water loss will be compensated by increasing thirst, which is polydipsia. Hence, PU and PD are hallmark of diabetes insipidus. The next point is decreased USG, urine specific gravity, which is known as hyposthenuria. So the specific gravity will be less than 1.006. This is also very important. This basically signifies the body's lack of ability to concentrate the urine. Hyposthenuria means the urine is too dilute. For your information, the urine should not either be too dilute or too concentrated. Both these things mean that there is something wrong with the urinary system. Now the third point, the third clinical sign is dehydration, because obviously there is a lot of water loss. Another sign is nocturia or accidents in the house. Pet, which means pet will not be able to hold pee, pet will pee everywhere. And in rare severe cases, CNS signs will also be seen due to sodium loss, because if the water is lost, sodium also follows water, and it will be manifested as weakness, seizures, etc. Now we come to the diagnosis. Diabetes insipidus itself is not a very important disease, but it is important with respect to differential diagnosis because it falls into the category of diseases that cause PU and PD, and there's a long list. So it is very, very important for NABLE to be able to differentially diagnose diabetes insipidus from other diseases and other diseases from this disease as well. So you need to study this disease more from a differential point of view. Now the diagnosis. The most important and the foremost thing to do is rule out the common causes of PUPD, which are diabetes mellitus, CKD, Cushing's, liver disease, pyometra, hypercalcemia, hypokalemia, hyperthyroidism in cats, leptospirosis in dogs, pyelonephritis, etc. So there's a long list of diseases that cause PUPD. The first diagnostic for diabetes insipidus is water deprivation test, WDT. It is done to check if animal can concentrate urine when dehydrated or not. It is performed under closed veterinary supervision and it is not commonly used because it involves risk. Now you start with gradual restriction of water, about 5 to 10% decrease each day over several days to prevent sudden shock at home by the owner. So the owner, before actually going to the vet, will start decreasing or restricting the amount of water that is given to the pet every day. It cannot be done abruptly. Now the water is withheld under supervision by the vet at the hospital, and the vet will monitor body weight, hydration, specific gravity every 1 to 2 hours. And immediately stop this test if more than 5% of body weight is lost, or animal looks sick, or specific gravity spikes suddenly, it plateaus. Now the two observations of the test are, if the specific gravity increases to normal or increases basically, then it means it is not diabetes insipidus or it is psychogenic polydipsia. Now I will explain what psychogenic polydipsia means. Psychogenic polydipsia is basically compulsive drinking. Animal is normal, there is no true diabetes insipidus, but the animal drinks excessively due to behavioral reasons. So there is no hormonal defect. Urine is dilute because of chronic over drinking, even though ADH is fine. So when water is gradually restricted, animal can concentrate the urine again. So the animal has not lost the ability to concentrate the urine, unlike diabetes insipidus. So psychogenic polydipsia is not diabetes insipidus. And in water deprivation test, if specific gravity increases to normal, this means the animal has psychogenic PD, or it confirms the absence of diabetes insipidus. On the other hand, if specific gravity still stays low, that means the urine stays dilute even after water deprivation. This confirms the presence of diabetes insipidus. That is all this test is about. Now the second diagnostic is ADH response test or desmopressin trial. Desmopressin is basically a drug that is synthetic analog of ADH. So it is basically the synthetic form of the hormone that we give exogenously. In this ADH response test, if water deprivation test shows no concentration of urine, next step is to give exogenous ADH, also known as desmopressin. Desmopressin is also known as DDAVP. So there are two names for this drug. Now what will happen? In case of central diabetes insipidus, the specific gravity increases after giving desmopressin. That means the urine will become concentrated after this drug. Why? Because the whole issue in central diabetes insipidus was the absence or lack of ADH. So once you give the exogenous ADS, it solves the problem. In case of nephrogenic diabetes insipidus, urine still remains dilute even after giving desmopressin. Why? Because the kidneys are still messed up. So the root cause of the problem is still the same. Injecting desmopressin does not fix the kidneys. So that is why in this case the urine will still remain dilute. So if the animal has psychogenic polydipsia, urine will already concentrate after the water deprivation test. So no further change with desmopressin because the urine has already concentrated. See, in case of psychogenic polydipsia, due to excessive water intake, the kidney's osmotic gradient is messed up. So it's lost, but it's not damaged. When water is gradually restricted, the animal can concentrate urine again because the osmotic gradient is restored during that time. Now I will summarize the diagnostic tests. First is CDI, the central. In water deprivation test, the urine does not concentrate, or in other words, remains dilute. But in ADH or desmopressin response, the urine will concentrate. Next is nephrogenic. The urine will not concentrate in water deprivation test. Again, it will not concentrate at the end of ADH or desmopressin response test. In case of psychogenic polydipsia, water deprivation test will concentrate the urine. And in case of ADH desmopressin response, there is no significant change because the water deprivation test has already fixed the problem. Now we come to the treatment part. Lifelong treatment is required. First one is treatment for central. The first drug is desmopressin /DDAVP, which is the drug of choice. Very, very important. It's a very important question for NAVLE. It is given in the form of oral drug or eye drops or nasal drops. It is basically a synthetic antidiuretic hormone. The second drug is chlorpropamide, which is rarely used. It falls under the category of sulfonylurea drug, which is anti-diabetic drug. It will just stimulate the release of ADH. Next is treatment for nephrogenic diabetes insipidus. No specific cure. The treatment is only treatment of underlying disease. An important point is you can give thiazide diuretics because they have a paradoxical effect. Now, what does this mean? In this case, in diabetes insipidus, there is already polyuria, and diuretics also lead to increased urination. So how do thiazide diuretics work in this case? Thiazides, they increase sodium or water resorption, and they will cause mild volume depletion because of their diuretic effect. So the kidney will compensate by retaining or resorption of sodium and water. I'll again summarize the treatment for central. Desmopressin /DDAVP is drug of choice. The other drug that is rarely used but can be given is chlorpropamide. For nephrogenic, there is no specific cure. The only option is to treat the underlying disease. Thiazide diuretics can be given in this case, and they have a paradoxical effect. That is all for diabetes insipidus. Also, sometimes in vet prep, they ask questions related to Sertoli cell tumor because it is also related to the endocrine system, but we need not to cover it separately here. It is already covered in under the reproductive system. Basically, Other than the 5 endocrine diseases that are mentioned in the ICVA list, we have covered diabetes insipidus, we have covered pheochromocytoma, and the third one is Sertoli cell tumor, which will be covered under the reproductive system.